My name is Cristina Quintero. I'm a medical student from the Universidad Autónoma de Durango, Campus Monclova, and I'm cursing the second grade. And now I'm going to show you some information about how helping patients with diabetes. Diabetes is a chronic disease that occurs when the pancreas is no longer able to produce insulin. The insulin is a hormone that helps glucose from food to head into the cells and then to be used for energy. In a few words, diabetes is a metabolic disease characterized by elevated levels of glucose, or commonly called blood sugar. And then we have three types of diabetes: diabetes type 1, diabetes type 2, and gestational diabetes. In diabetes type 1, the immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes is usually diagnosed in children and young people, although it can appear at any age. People with this type of diabetes need to take insulin every day to stay alive. So it's also called like juvenile diabetes or insulin dependent. In diabetes type 2, the body doesn't make enough insulin or doesn't use the insulin well. People can develop type 2 of diabetes at any age. However, this type of diabetes occurs most often in older people and middle-aged people. This type 2, is the most common type of diabetes, and also it's known like insulin resistance. And finally, we have gestational diabetes. This type of diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if the women had gestational diabetes, they have a greater chance of developing type 2 of diabetes later in life. About glucose levels, we have a classification: normal, prediabetes, and diabetes. The fasting blood sugar levels, normally we have between 70 and 100 milligrams over deciliter, and the post-meal blood sugar levels, in normal, we have between 70 and 140 milligrams over deciliter. In prediabetes, in fasting blood sugar levels, we have between 101 and 125 milligrams over deciliter, and the post-meal blood sugar levels of prediabetes, we have 141 or 2000 milligrams over deciliter. In diabetes, in fast blood sugar levels, we have 125 milligrams over deciliter, or this can be more. And the post-meal blood sugar levels of diabetes, we found 2000 milligrams over deciliter and above. And then we have some risk factors that can induce of any of these types of the diabetes. These factors include old people, sedentary lifestyle, unhealthy lifestyle, overweight, and genetic inheritance. And then we have some signs and symptoms about the diabetes. We have polydipsia. The polydipsia is when the patient feels thirsty all the time. They, despite drinking a lot of water. And the polyphagia is when the patient feels hungry all the time. and sometimes the patient can have blurry vision, twinkling in the hands, they can weight loss, and they have a slow healing, and also they have a lot of fatigue. And some of these complications about the diabetes, we have heart disease, cerebrovascular disease, diabetic nephropathy, diabetic foot, and glaucoma. In the treatment of the diabetes, we found glucose monitoring. It is using in serial cases. And then we have diabetes medication. In this diabetes medication, we have insulin pills like metformin and glibenclamide, and we have insulin injections. So, how to prevent the diabetes? The diabetes can be prevented eating healthy, doing exercise, no smoking and drinking, losing weight, managing the stress, and being positive. If you follow these recommendations, you cannot be diabetic. So, take care. The health is first.